Welcome. Good afternoon. Thank you so much for being here today. We are excited to bring back another fantastic webinar today with some really amazing speakers and a wonderful local partner talking about telehealth assessments and diagnostics. Thank you so much all for being here, for your time today. As we get started, just want to start with some brief housekeeping. I will be monitoring the chat, so if you have any questions and if you want to drop a hello so we can know who we're speaking to today, that would be wonderful. Just would love to get to know who's out there. And if you have any specific questions that you want our speakers and our panelists to cover, it would be great. So feel free to drop a hello in the chat box. You will be receiving a copy of the presentation and the video upon request. And so after the webinar, you will receive an email. And if you would like a copy, feel free to ask us and we can send that over. But you can also find this webinar today on Kayo's YouTube channel. So let me go ahead and share that with you in just a second here. So if you go to our website, there are tons of events, upcoming webinars, different blogs and different resources that we have available for families. And all the way at the bottom, you can see our YouTube channel here link, and you can also find some great previous webinars that we have done, and then this one will be listed there as well. Our partner today is Jigsaw Diagnostics. And they are providing telehealth-based ABA or autism diagnoses. And so just really recognizing the need and the wait times that families are experiencing to receive a diagnosis. It's just so important to be able to recognize that early detection and early treatment is tremendously important. And they'll be talking a lot to us about being able to get in and see a doctor and get a diagnosis as soon as possible. So feel free to reach out directly to them. This is their information and they're here today to talk all about it, but they do offer free consultations. And so it's a fantastic way after the webinar, if you had additional questions, for you to link directly with them and to learn more. All right, so I will get started. Like I said, we're going to learn about telehealth assessments and how this is going to better enable our families to be able to make quick decisions whenever there's any developmental or behavioral concerns that they have for their children. And these virtual evaluations are convenient because they're happening from your home. So really allowing a child to stay in their natural setting while the doctors are able to assess and provide these diagnoses. So our panelists today, they'll talk a lot about how telehealth is allowing increased access for services for families, especially who are living in remote areas. Talk a lot about wait time reductions, and so not having to wait a very long time for an appointment, and as well as reduced cost for telehealth evaluations. And so along with these benefits, we'll also discuss telehealth assessments, what this looks like, and maybe what children are best suited for these types of diagnoses as well. So without further ado, I'm going to go ahead and introduce our panelists. I'll begin with myself. My name is Jagmeet. I am a Senior Regional Director here at Kayo. Very excited to be a part of their webinar series. We always receive feedback and we are always listening to feedback. So if you have a topic that you want us to bring to you and you want to learn more about, feel free to reach directly to us so we can bring that topic. But from Jigsaw Diagnostics, we have two doctors here with us. We have Dr. Ashley Berry, who is a licensed clinical psychologist trained in the assessment, diagnosis, and treatment of autism spectrum disorder, ADHD, complex trauma, and developmental delays in children. Through her APA accredited graduate program and internships, she gained valuable experience working as part of multidisciplinary child assessment teams alongside developmental pediatricians, neuropsychologists, speech and language therapists, and occupational therapists. Dr. Berry's prior child and adolescent assessment experience includes San Andreas Regional Center in California, subcontracting with Kaiser Permanente, Casa Pacifica Centers for Children and Families, and the Marshfield Clinic in Wisconsin. We also have Dr. Kelly Yost Abrams, who is the co-founder and head of operations for Jigsaw Diagnostics. She is a developmental psychologist and specializes in parent-child attachment relationships and supporting parents. She provides expertise to leading pediatric organizations such as Baby Center and has been at the forefront of digital therapeutics and telehealth. Dr. Abrams received her PhD from the University of California, Berkeley, and is a fellow with the 023. And then lastly, we have Kyo's very own Nicole Bollinger. Nicole is a BCBA and a regional director who's been part of the team since 2017 and working in the field for over 15 years. Nicole is passionate about ABA and how it can improve the lives of individuals with autism and their families. She's worked in schools, home, community settings, and Nicole has experience training staff, developing individualized interventions, and creating classroom adaptations and modifications. Nicole has presented at the state, national, and international levels using topics on using iPads in the classroom, differential reinforcement, video modeling, and stimulus control. In her free time, Nicole enjoys spending times outdoors with her family. And so with that, I'm going to go ahead and hand this over to our distinguished speakers, and looking forward to hearing from everyone here.
Great. Thank you so much, Jagmeet. I'm excited to be here today and talk to everybody about Jigsaw Diagnostics and how we're approaching evaluations for children with concerns for developmental delay and autism. I'll go ahead and share so that people can see the slides. Great. And is that, if someone could just confirm that you're seeing the slideshow?
Yep, looks good.
Awesome, great, thank you. And please, as we're talking, if people have questions, throw them in the chat. We're happy to answer all of your questions as we go and take this in whatever direction is most useful. All right, so let's move on from the introduction. All right, so at Jigsaw Diagnostics, we're focused, of course, on having a very easy, streamlined, supportive process for families. As you heard in my introduction, I have been working with families for a long time, and my aim and focus has always been to support parents in their relationships with their children. And I've taken that to Jigsaw because I know the experience of families when they're concerned and worried about their child's development, and then they need to get some sort of evaluation or diagnostic assessment, it can be very confusing and a long, arduous process. And we wanted to change that at Jigsaw, both really from the family's perspective as well as the clinicians. We thought there could be a better way to help families get the answers they need in a much more timely manner, and really support them along the way so that their questions are answered, they know what to do, they know what to expect, they receive a really thorough evaluation and kind of understand better what's going on with their child, and then most importantly, what to do next. I think that's the missing piece a lot of the times, where families maybe receive an evaluation, but they're still left with so many steps and hurdles after that point. And so we're really aimed at reducing stress and burden for these families as they're seeking a diagnosis, being able to provide that whole evaluation within a matter of a week or two, no wait times, and then very personalized, tailored concierge support after the assessment to help connect them with the most appropriate services. And we feel in this way, this kind of comprehensive, supportive way, we're going to be able to improve outcomes for families. Waiting is very stressful all the way around. And we know that children are then not getting the services they could most benefit from during the most critical time of brain development. So we want to change all of that. And most of you may have seen that there's recent prevalence numbers out from the CDC, so that we know that autism is quite common. It's about 2.3% of children, or 1 in 44. And we need to do a better job overall in helping these families act on their concerns when they have them at a young age and get them into services. Okay, I'll move on. So I thought I'd start with a little bit of what we've learned during this pandemic time that has been so unusual for all of us. And it's really pushed the field a lot of clinical psychology towards more telehealth practices overall. We were really kind of behind the times, I think, for a number of years in terms of how we approached both treatment and assessment for young children. And so the first question, right, is, well, how accurate are these remote or virtual telehealth evaluations for children with concerns for autism? And that's a really valid question to be asking, because of course we want to be as accurate and comprehensive as possible. And so in the beginning, I think most clinicians and families had a lot of concerns, a lot of skepticism. And there was a whole consortium of advocacy groups, autism centers, researchers that really came together and to think about how should we approach virtual or telehealth evaluations, and what are some best practices we can come up with. And in doing so, they really identified that being able to observe a child in their natural environment at home, where they're most comfortable, really was a missing piece that a lot of in-person assessments hadn't been able to capture previously. And that could be a really crucial, important view of the child that would actually make these evaluations potentially much richer in the data that we're able to collect on a child, and much potentially even more accurate in terms of the final assessment. And then sort of towards the end of 2020, there was a scoping review looking at various publications that had really compared and contrasted and tried to evaluate doing these assessments using telehealth methods versus in person. And the research is still young, right? We're new to this. But so far, it's looking like there's high degree of concordance and accuracy between both approaches. And like I said, actually a lot of advantages when we are able to view the child from home. And I think at this point, I'll turn it over to Dr. Berry, and she can talk a little bit about her own experiences making this transition.
Thank you. Yeah, so I was doing evaluations in person prior to the pandemic. And then when the pandemic happened and we had to essentially stop working, it was only going to backlog an already very backlogged system on making people wait for evaluations. So the decision to move to telehealth evaluations for me initially was I was a little skeptical, and I didn't feel like that was going to be something that was really feasible, nor would we would be able to get diagnostic accuracy. And I was probably about half a dozen to a dozen evaluations in when I realized not only was I able to get some really good behavioral observations and some really good data, but that this was probably a way that the field needed to move in a way at a minimum to provide a screening for families with children who had concerning behaviors or parents were on a really long wait list. So my skepticism completely flipped, and I was becoming at that point a big advocate for allowing this to be more normalized in our field. And like Dr. Yost Abrams said, psychology sometimes tends to be a little behind, and I was hoping that that would be something that we could embrace, doing this more from a telehealth standpoint. And so I continue to do these remote, and a lot of times but there was a lot of push to go back to in-person. And I think in some ways, some agencies are still doing a lot of remote evaluations. And I'm hopeful that moving forward, remote evaluations become relatively normal, regardless of what the larger atmosphere is, whether there's a pandemic or not. So I'm going to go ahead and discuss kind of what the process looks like. So generally speaking, when we have a family that's interested in a telehealth evaluation, we try to screen them. And that's to say, not all families and children are going to be appropriate for a telehealth evaluation. And so we determine the eligibility through our screening process, and then we can schedule the appointment if the child and the parents are in fact good candidates. And then prior to the appointment, we have the parents and other providers, whether it's daycare, maybe speech and language or OT, that have been working with the children, if that is the case, state preschool, or other family members can report on things through standardized assessments that we have. And we gather that information, we gather biopsychosocial information, and we strongly encourage parents to upload videos of their children that I can review prior to even meeting for the actual telehealth appointment. So after we receive all the information that we need, I review it prior to the appointment, and that allows me to kind of come prepared for the family and really tailor my questions and get more information where the parents have described concerns that they have, and kind of dig in deeper and not spend time during the evaluation getting the basic information that I could get beforehand. And then also during that evaluation, I am able to do anywhere between a 15 and 30-minute observation of the parent playing with their child. Because when we've done these assessments in person in an office, essentially what we're doing is we're trying to get behavioral observations that we would see in a child's typical day, but in a condensed time frame. And so that's why measures like the ADOS exist, is to try to elicit and facilitate different social interactions in a smaller amount of time. And I'm essentially coaching the parent through that while I'm doing the telehealth assessment and the observation, and then scoring some assessments that relate to the observation. And most of the time, a diagnosis can be rendered. There are certainly instances where a child's presentation is more complex and a diagnosis cannot actually be rendered, but I'm still able to talk through with the parents what they might want to think about as far as next steps and what I'm seeing, whether it's some autism symptoms, trending towards maybe some concerns for intellectual delays, or ADHD and other neurodevelopmental symptoms that we see in the younger population. And then I provide feedback. And most importantly, after I'm done meeting with them, once I create my report, I then send that to Dr. Yost Abrams, and she is able to create a very tailored treatment plan for the family that we use based on their zip code. And that's our process right now. So when thinking about who would be a good candidate for telehealth assessment, right now we're generally seeing children between 18 months and 8 years old. There is an asterisk there, so I want to address that. From 6 to 8, The diagnostic picture can become a little more complex. We can start to see mood symptoms emerge here. Children may have like early experiences of anxiety that may complicate the diagnostic picture. So between the ages of 6 to 8, we tend to get a little more stringent on our screening. This is a great referral for children who are maybe served in the school system under speech and language impairment, but there are strong suspicions that it is autism and they just haven't received a formal diagnosis. In those situations, we can, ask the parents to get the psychoeducational. I can review that, and I can also have like collateral data from the school with their behavioral observations. So generally 18 to 8 months, with 6 years old to 8 years old being a little more finite on what we would accept. So other instances or other good referrals are for children who have been around other children. So that's a complex thing that I've had to actually start screening for with the pandemic. Oftentimes, by the time they're seeing me, they may have been born right prior to the shutdown with the pandemic, or they were, 6 months, 8 months old, and then the pandemic happened, and they just really haven't had access to other children, nor have their parents been able to observe them around other children. So if that really hasn't been the case and the child's been pretty isolated, then we take those on a case-by-case basis, because obviously it's based on a social skill observation and the parents being able to report on that in their community or observing their child. And if they can't do that, then it would limit the evaluation in some ways. And then also children who have moderate to severe delays are really good referrals for this particular type of process. And that goes, I think, for two reasons. One, those children tend to have a more difficult time, this is generally speaking, going into a new environment. And so oftentimes when they go into office appointments to be evaluated, their behaviors are counterproductive for a lot of the assessment procedures that the clinician would need to do. And so because of that, I actually think they would be better candidates oftentimes for telehealth, because they're in the comfort of their home. It's around their toys. They don't have to sit in a long car ride to get to an unfamiliar office, and then aren't really willing to participate in the different tasks that the clinician needs to see from them. So generally speaking, those are some really good referrals for this particular type of assessment. Who would probably benefit from a in-person evaluation? And so this is kind of giving an insight into how we're screening for these. We certainly don't want to put a family through 3 hours of a telehealth evaluation and filling out all these different forms for us, and when we know that they're probably just not going to be a good candidate. So we try our best to make sure that when people are moving through our system, that they're really going to get the answers that they want and that they're appropriate. So children who are not walking, just in general, would not be a good referral source. If a child's not walking by 18 months, there could be a number of other things going on. And walking is a big component of a lot of the interaction piece. So when a child isn't able to independently move around on their own, that would be a bit of a limiting factor. Right now, we're just not set up for children who are monolingual, non-English speaking. And so I think in general, those individuals need to be seen by a practitioner who maybe is fluent in their native language, and or in an in-person evaluation with maybe a translator. And I skipped a bullet point. Let me back up. Dr. Yost Abrams and I both have a strong background in attachment. And so we're familiar that children who've had any prolonged separation from their caregivers, have been involved in the foster care system, have resided in multiple foster homes, a lot of difficulties with attachment and even self-regulation sometimes are really clouding the diagnostic picture. And so any child who also has had a trauma history just probably would not be a good candidate for a remote evaluation. And then skipping down to the fourth bullet point there Any complicated medical histories or known genetic anomalies, again, I think that those require more of a thorough evaluation. And so those are for children that should be seen in office. And then going back to my point earlier about the 6 to 8 years old, if a child's 7, they're verbally fluent, they have very, very mild symptoms, it's hard to determine if it's ADHD and some anxiety or autism, then I would suggest that those families go be seen in person to have more of a comprehensive evaluation performed.
Thank you, Dr. Berry. I think I can start talking about this one, but feel free to jump back in. And I see there's potentially some questions building up in the chat too. So overall, we're really noticing a lot of benefits from this type of approach. Right off the bat, there are lower costs associated for families. We're able to offer such a streamlined process and really optimize using technology that we're able to pass those savings on to the families that come with us. But in general, no matter where you go for your evaluation, if it's using telehealth often, there's less travel time, less time off from work. You don't need to get a babysitter for a different child. You're still within your own home. And then, there are fewer and fewer practitioners out there actually offering, that have the experience to do evaluations for autism, just nationally. We're seeing that trend. And so the families who live in, more rural areas or that are not near a major children's hospital or autism center often have to, travel quite a ways and schedule appointments, months and months and months out. And so, being able to be seen in a matter of days or even, just a few weeks from your own home is obviously a clear advantage for these families. We've talked about this throughout, but having the child, in their own comfortable home environment with their own toys, interacting where they're most comfortable, really allows us to see, and Dr. Berry to see their most typical behaviors, how they are interacting on a day-to-day basis. And I'll sort of jump around here as well on the bullet points. But if it's a situation where, at the end of the evaluation, the parent is really, communicating back to us that this was not a typical day for the child, it's fairly easy for us to quickly, schedule another short observation for that family and get another snapshot or picture of the child and really make sure we're seeing the child at their most typical and getting the most accurate data as possible. Dr. Berry, I know we had a family that happened with. I don't know if you want to briefly talk about that one.
Yeah, I was actually thinking about that family too. I did want to add really quickly that when I was doing these in person, oftentimes I had families that drove an hour or 2 hours to get to the appointment. And it's kind of standard procedure for me to ask. So, how did they sleep last night? How's the morning been? And if the report is coming that they didn't sleep well, it's been an extra rough morning for us. Oh, they just fell asleep in the car and now I had to wake them up. So they're probably going to be even more grumpy. I'm already in my head thinking, okay, I'm going to have to consider all of this today as part of the presentation. And the flip side of a telehealth evaluation is if that's how we start the telehealth evaluation, I can very quickly be like, okay, well, why don't we do the first half today and schedule another time right now, get it on the calendar for the observation between you and your child, but I can at least gather your concerns and get the information that I need for my assessment. And then the family that we've seen that did require 2 observations, I have to say it was really nice for me as the clinician to be able to just easily do that. I didn't have to say, okay, now go schedule with the admin and then make sure that it's a 40-minute slot that's in my book, or let me squeeze you in because I'm so booked up. I could just go into the calendar, we could schedule it. And within that same week, I was able to do a second observation of the child. And I think those two I know those two observations combined were really helpful for me diagnostically. And I think the parents also appreciated that I took the time to do the second observation versus kind of like shooing off their concerns from the first one.
Yeah, we've got a lot of good feedback from some families where they really appreciated that you were able to observe them at home, and they felt it was such a better experience than other types of appointments where they've had to go in.
Yeah.
Yeah, and I think just to wrap it up, right, we know that all of the most important benefit of all of this is that children can access the most appropriate interventions sooner and earlier in their development than when they need to wait for the diagnosis or the evaluation. And reducing wait times and stress overall, as I started with, for families is our primary aim. We want to be supportive and allowing children to get the support they need as early as possible is really our overall goal. And to make sure that families get their questions answered along the way, because when parents are stressed, that the whole family system is stressed, and that's not good either. So I think we're about at the end. We have our information here, and as Jagmeet indicated, we offer free consultation. So if any families, are wondering, have concerns, not sure what to do next, or are waiting on some other wait list, give us a call. I'm happy to talk with you. I want to hear about your concerns. And, even if it's not an evaluation with us, we want to make sure that you're getting the answers you need as soon as you can get them. Thank you.
Thanks.
Thank you so much. That was just so fantastic. And a lot of the points, reiterating that convenience factor and, having the ability to see the child in that natural environment is just so important. And I think, Dr. Berry, that example just really hit home in terms of all of the factors that kind of go into just, having the child travel to a location and then being observed and having determination or diagnoses kind of made there. But it's really exciting to see the evolution, the advancement, being able to bring in technology into this, field, and how we're able to kind of develop and grow from that as service providers. So I do want to introduce Nicole and a little bit more about our talk today, but I would like to pause and see if there's any questions. I know there was a question about, this information being so useful and, are the slides going to be available? And yes, that will be. But any particular questions in regards to the process or anything that the team has discussed so far? I will continue to monitor the chat box, but I will now introduce Nicole Bollinghoff, our Regional Director at CAIO, to talk a little bit about telehealth and ABA.
Thank you so much. This has been so amazing to hear, and just super excited to talk a little bit more about CAIO, our services, and what our telehealth ABA services look like. So as Jagmeet mentioned, I'm a BCBA and the Regional Director of our telehealth region here at CAIO. And I am going to admit that I, prior to the pandemic, had little experience providing telehealth services, receiving telehealth services myself, and was a little nervous initially about how this transition would go, but quickly was able to see how effective and convenient these services could be for families. So again, I'm just going to tell you a little bit about CAIO, our telehealth services, and we'll share some anecdotes along the way. So here's a little bit of information about us. We're a team of over 600, including behavior analysts or BCBAs, program supervisors, behavior technicians, and administrative staff. We provide ABA therapy, parent training, behavior consultations, and school or community support. And as we've grown, we've really been able to develop a specific telehealth region of BCBAs that are skilled in providing remote services to families. This has been really beneficial to reach our communities and families along the way. We serve some of the following areas. So we are in California in the San Francisco Bay Area, Sacramento, Los Angeles, San Diego. In Oregon, we're in Portland and Salem. Washington, we have Seattle and Tacoma. In Utah, Salt Lake City. In Arizona, we're in Phoenix. In Colorado, we have Denver and Colorado Springs. And in Texas, we are in Dallas, Austin, San Antonio, and Houston. If we are not in your area at this time, stay tuned. So just a little overview of our pillars and what we really think is important as an APA provider. We at CHIO use two measures to determine the effectiveness of our services. We measure mastery of learning goals and skills, as well as progress on the Vineland, which is an objective measurement tool. This is completed by a behavior analyst via interview with a parent or caregiver every 6 months. Our families have access to their child's scores across time and receive notifications of goals or targets are being met through our CHIO Care portal, which we'll talk a little bit about next. This information is also regularly reviewed in consults with behavior analysts on their team. I think some of the benefits of telehealth is we're able to really do this, meet with the parents, screen share, show them graphs and trends at times that are really convenient for the family. So we also take pride in convenience. This is the same portal where parents can see their Vineland scores, get those notifications of goals and targets being met during sessions. And this is our web-based portal that allows families to view their upcoming sessions, cancel, and reschedule with a touch of a button. Our motto is make every moment count, and we really want to ensure our sessions are effective and efficient. We're always assessing ways to make sure that the services we're providing are unique to that individual, their personality and profile. And we also understand that time with the family is integral and look for ways to preserve that family time outside of treatment and sessions while maximizing progress. We regularly review and measure progress, review current trends or adjusting goals, targets, materials, or presentation of that skill to ensure we're matching the individual that we're working with, their own personality and profile. Our team has a large group of BCBAs to collaborate with within their local region and then company-wide as well. So now a few specifics about what our telehealth ABA services may look like. We offer a variety of services within our telehealth region and company-wide, and some of these include parent training and consultation. So within our telehealth region, these parent trainings or consultation can be part of almost a graduation from those direct therapy sessions for a child. So maybe this individual no longer needs that one-on-one direct therapy. This model, the parent would continue to consult with a telehealth BCBA and foster generalization of skills and maintenance prior to discharge. We also offer a standalone parent consultation and training model. So this might be for families who don't necessarily require the intensity of direct therapy services, or maybe some other factors such as relocation or an unexpected situation within their family dynamic that doesn't allow for direct services. In those areas, we're able to offer just the parent training or consultation model. Our telehealth team also supports local regions, and some of the ways they do so is supporting teams when there's a need for an interim support. So maybe a family's BCBA goes on a leave of absence and they need interim support for a short term, the telehealth team can jump in there. We can also complete assessments with in-person support as needed. And kind of as Dr. Abrams and Barry mentioned, this makes that process a little faster sometimes. We're able to get those scheduled sooner than another BCBA in the area that might have some other limitations with their schedule, our telehealth team is more readily available to take those on quickly. And we do offer some opportunities for in-person support as needed. So if we're getting ready to consult with that family, request a telehealth assessment, we can talk to them about maybe having somebody come out to the home once or twice to observe them at home, take some data for us, and do the rest remotely. So how do these telehealth services work? They're conducted via Zoom and can take on a variety of forms. So right now, one exciting modality my telehealth team is working on is doing virtual play dates where they can target social skills with parent support. This has been really fun to watch grow and develop, and it's something early on in the pandemic, me and my teams have realized there was a real need for. A lot of kids didn't have many social opportunities. So we were able to connect them with other peers that may have a similar skill set or similar interests that might not necessarily live in their area, but would be a good match for them personally. And they've been able to connect and work on some of those social skills during this difficult time. We have been really, excited and using a variety of techniques, such as, meeting with a parent via Zoom, having them wear headphones, and then coaching them through in the moment how to respond to behaviors. It gives us opportunities to observe during specific times of day and provide strategies to foster growth and independence. And we've also been able to possibly meet with a variety of family members that in person we may not have seen if we were to come out to the home during session. Instead, there's an aunt or an uncle that parents really think would benefit from learning about the functions of behavior or learning something specific to that child's individual behavior plan, and we can meet with them a little more easily as well. So some of the benefits of telehealth ABA services is accessibility, kind of that ease of scheduling, again, giving us unique opportunities to observe. Like I said, we can, a parent could ask us to join and observe during dinner time and set an iPad up on a shelf across the room so we can kind of see how that dynamic regularly unfolds and then provide suggestions or strategies or materials to utilize during those times. And support during different times of the day. It's a little easier via telehealth to observe a morning routine or observe a bedtime routine instead of the travel and commute and scheduling of getting that in place. And as I mentioned, some of those virtual play dates. So being able to find someone that would match your child's unique skill set or similar interests to them, and they can work on those skills together virtually. I think one of the biggest highlights for me was I was in the middle of one of our ABA assessments when everything first happened and was going to shift to completing that virtually. And again, to be honest, I did not know initially. It took a lot of thought and processing, like, how am I going to finish this assessment via telehealth when I am used to being there in person? I have my materials ready and I always know, how to probe some of those skills or do some of those routines. And I had luckily in this situation had the experience. I was in the home once already, so I knew what toys were available, what activities they had on hand. And I was able to coach the parent through, okay, before we even log on, I want you to have these items available and let's put out some of these toys. And these are some of the things I'm going to ask you to do. And I just had I coached the parent through asking some of the questions that I would have normally done on my own when I was there. Following that assessment, the parent had shared with me, they were a little anxious as well. They didn't know how this was going to go or if they were going to be able to ask those questions that would give them the same information that I would normally do in person on my own. But they shared, I was able to see exactly how things would normally go, exactly how their child responded to them, the types of interactions they had without having, a stranger in your home following you around, asking you some of these questions or observing some of those interactions. So it's been really amazing to see the benefits, and we're eliminating a lot of those barriers, as Dr. Berry mentioned, of having, a child go into a clinic is one example for the assessments. I talk to parents all the time about this, that once their child, yes, has driven to a location, it's maybe at a different time of day they're not used to. But the same goes for, as I mentioned, a stranger coming into the home and being there to assess them and meet with them and ask them some questions, and they don't know me to begin with. But it's been really exciting to see some of these benefits of our telehealth services. I will share with you, we have complimentary behavioral consultations on our website, and there are links here for if you're interested in learning more and would like to talk to somebody, you can see those as well.
Thank you so much, Nicole. We do have just a minute left here, and we do have some questions for the Jigsaw team if you guys are available here. So first question that came in is, what tests can be administered online? Yeah,
there we go. So I'm going to answer these questions as though like this is what we do in office and this is how we're replicating that, because I think that that helps give people an understanding of how this is different but also similar. And oftentimes parents would be completing an adaptive measure, a measure that looks at just the child's global development, so cognitive skills, language skills, motor skills. And it's, you know, this is done various ways. Oftentimes I know in ABA companies, they'll often use things like the ages and stages questionnaire to just try to get a broad base of where the child's at. And many times parents will, if their child's being evaluated in the office, they would complete that form either prior to the evaluation, but most likely they'd be completing that form during the evaluation. And we have the parents complete a developmental measure that gives us a broad understanding of their domains based on what the parents viewed their child do or not do. So that's one very, very important piece that we have them complete. We also have them complete a measure if the child's old enough that looks at potential behavioral and emotional symptoms. And so this would be for looking at the 5, 6, 7, 8-year-old range. And then we also try to have, like I mentioned before, another rater also complete that form so that we can consider what the child's looking like in multiple environments at that time. So that's what we use for our slightly older children. And then the other measures that we use as far as looking at autism symptoms are the Tele-ASD PEDS is one that has been normed essentially for virtual assessment. So that's one that we use pretty consistently. That age range isn't too old, but what it does is allow the parent to replicate some of the things that are done during the ADOS modules, which are done in person in office. And kind of like what you had already mentioned, they are essentially doing different presses, if you will, of the ADOS, the parent is. And so a lot of the toys are similar: cars, pop-up toys, bubbles, and the parents are aware that these things need to be accessible during the observation. And so it's essentially recreating that observation schedule, but for the parent to move through the tasks with the child.
That's fantastic. Yeah, so I think putting the parent in the driver's seat and allowing them to kind of support that. Thank you. And I think the second question you've answered within that is, which standardized tool do you use for telehealth evaluations?
Yeah, basically the same thing. And it varies, depending. This is what makes us, I think, more of like a concierge boutique service. You call, you speak with us, we get a good understanding of your concerns and what's going on. Then I meet and we consult on what would be a good assessment. Not every child leaving our assessment is going to walk away with the same measures used. It's really based on what the referral question is and what the concerns are.
Wonderful. If there's any other question, feel free to add it into the chat box. I know that we're 2 minutes over here. One last question I have for your team is, what areas are you currently serving? I know that that's something that's been coming up, but what areas, in what areas that families can reach out to you to get services?
Yeah, right now, I'll take that. Right now, Jigsaw is operating throughout all of the state of California. So any family residing in California. And early in the next year, in 2022, we'll be expanding most likely into North Carolina and Pennsylvania, but that's still a little bit TBD. But we are rapidly scaling and expanding and look forward to helping more and more families.
That is wonderful. Well, thank you so much for being here today. I think that there was a lot of valuable information that was shared. And to all of our guests that were here, thank you for your time. And we will send over information, and feel free to reach out to any of these members through the various different ways that we shared. But have a wonderful day, everyone.